when I worked for one of my previous employers, and part of that process on a daily basis was teaching AI to come up with the most appropriate response based off the inquiries we were receiving, right? Well, they essentially were having us train AI to eliminate our jobs.
Great, and welcome to the next edition of Merakoi Voices. This is our fairly new podcast on patient voices and implications for healthcare and healthcare innovation. This is our fourth episode, so fairly new, but welcoming back everybody from our early listeners to hopefully some new listeners. Today I'm joined by Jeff TenBroeck. He's based out of the United States and kind of a dual personality. He's both a patient advocate and a business entrepreneur. So we're excited to talk about the use of AI in business and in healthcare. And Jeff, welcome on board.
Thank you, Kevin. I'm super excited to be here. Thanks for having me today.
Perfect. So as I said, we're going to kind of dive into multiple aspects of AI usage. There's no clear script for this, so we've discussed about mainly starting on a personal side. And Jeff, maybe you can walk us through your own journey as a patient advocate and how you've started to use AI.
Yeah, of course. So I started my whole patient advocacy journey back in, I'd like to say 2017, 2018. I attended the National Eczema Association Expo in Chicago, and that's where it all began. I, of course, met some really interesting folks, and they presented the idea to me, and it all just kind of came into place. I'd say it was a long time coming. I've had eczema since I was pretty much born, so I've certainly had my fair share of experiences in that world, and felt like it would be a great opportunity for me to help other folks along their eczema journey through those efforts. So that's how I began.
Yeah, and as we kind of got to know each other, Jeff has worked on a number of projects in co-design and co-creation in addition to his advocacy work. And one of the common themes that we've seen lately is the use of AI, both on a sort of very personal level, people looking at using AI to, for example, understand their diagnosis, but also AI in co-design projects. So thoughts on AI, Jeff? Because if somebody's today, let's take a newly diagnosed eczema patient,
Hmm.
what would you recommend, or what would your sort of advice be to somebody on using technology and AI in particular to understand their disease?
Yeah. Well, I think there's a lot of pros and cons to it. So I think it's very important to proceed with caution. Everything that you read needs to be taken with a grain of salt. I've been working with AI for about 5 years now. One of my previous employers had a proprietary AI tool that we would use to help generate responses based off inquiries coming in on social media. So I've seen just how far it's come over that period of time, but it's still not perfect. There's still a lot of growth that needs to happen with the development of that technology. So I think it's very important to keep that in mind as you get started. Now, on that note, there are quite a few tools that one could use. I personally like to use the basics, right? ChatGPT, Google Gemini. I think those are great tools for getting a better understanding of the condition and possible treatment options. Now, once again, it can be a little bit limited based off how that AI technology has been, what's the word I'm looking for? Not developed, but taught, so to speak, right? There could be time limitations. For example, with ChatGPT, if you're not paying for it, you're only as good, or the information's only as good as like the previous year, right? So there might be some gaps there. But overall, I think it's a great place to at least get started, start learning more about the condition and how you might be able to live a healthy and successful life with that.
Right, and we've seen that things like ChatGPT are essentially available for free.
Hmm.
Obviously, you can subscribe to the pro version, but it's accessible for pretty much anybody with an internet connection. Can
Correct.
you walk us through sort of how would you use, like, take ChatGPT?
Yeah, of course. So how I use it personally is I like to have a conversation with it. So uh, if if you do a Google search right now for to learn more about eczema, I'm sure you noticed that there is a little blurb that pops up at the very top. It says AI generated and gives you some answers to your inquiry. So I was using AI to have those types of conversations before that was even available, right? So I would ask a question. I would basically uh, use AI instead of Google to learn more, right? So I'd ask a question, it would provide me with the output. If I had additional questions, I would follow up with those as well till I checked all the boxes and had everything answered that I needed to know on my end. That's how I've kind of used it. Um, but I'm sure there's quite I'm sure there's many more applications that folks can use it for as well.
Right. So it's like a kind of a companion or an advisor. If you chat with it, it will speak or respond in a fairly natural way.
Right, exactly.
It also has sort of the potential downside of it. It sounds very authoritative in the responses. I'm sure you've noticed. Uh, and
Yes.
for that reason, it can sometimes be almost like, telling you the answer, which may or may not be accurate. Uh,
100%. And I think that's one of the biggest pitfalls with the technology. Once again, it's only as good as the machine learning or the programmer who's taught it. I apologize. I know I'm using
I guess it would be training of the models.
the training
Yeah.
of the model. Yes,
Yeah.
thank you. I appreciate it, Kevin. The training of the model. Um, so I would say, yeah, that's one of the biggest pitfalls when it comes to that. So once again, you have to take all that information with a grain of salt because you never truly know. So one of the additional steps that I like to take is to verify that information from more credible resources online. I mean, there's a plethora of them at our fingertips. So just trying to find one that can back that statement up and just verify that that information is accurate before I proceed with taking a particular action, if that's applicable.
Yeah. Yeah. It makes a lot of sense. And I'm sure we'll find people who are actually taking their, advice from AI ChatGPT to their physician as well and seeing
I'm
if they can
sure.
have a discussion about the accuracy of that.
I'm sure.
Um, there's, the AI has been in the news a lot and not always in a good way. I'm thinking about 1 month ago, I think it was early December, the killing of the United Healthcare CEO. That was a pretty shocking event. And even more so was the reaction to that event afterwards. Um, on social media, people were actually venting in
Right.
many ways about, I think in the US in particular, about the coverage of healthcare. And beneath that seems like actually an issue with AI and algorithmic decision making, which has been going on for some time.
Hmm.
Who gets covered, who's not. It doesn't seem like it's always a human decision, and I think that's possibly one of the reasons why there was such a negative reaction
Yeah.
on that. And this brings us to the point about how is AI potentially changing our healthcare systems. I don't know if you have thoughts on that, what that implies, or what we can do about that.
Yeah. So in my opinion, it's not exactly changing it for the better when it comes to decision making for claims. In my eyes, I see it as the company's prioritizing profits over patients, and I think that's problematic. I think that we all have our own unique needs when it comes to our healthcare, and having an AI tool that has minimal understanding of our unique situations, making these potentially life altering decisions, I think that's unacceptable. I think that there needs to be a human touch, human element involved with all of that, with those decision making processes. Um,
Yeah.
Patients
Do
shouldn't
you
be
see?
treated like just additional data points at the end of the day.
Yeah. 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 It, do you see that it used to be the decision was essentially your physician, your doctor,
Right.
uh, that was primary. And do you see that changing? Or I don't know if you personally have experienced it, or if you see that with others.
Yeah. I can't. I've personally been denied on denied claims when it comes to my healthcare. I can't speak to whether or not it was AI technology that was making that decision, but I know firsthand how big of an impact it made on my life. As I mentioned at the beginning of this conversation, I've had eczema my entire life. there hasn't really been many treatments that have been very effective for me until biologics became available. And when that happened, I of course wanted to try them out. One of my good friends, he is also a eczema patient, very severe condition. He actually had to drop out of college to go to the Mayo Clinic for a period of time because it was so severe. And he had a lot of success, so I wanted to get on them as well. And despite the fact that I had already tried all of the medication, most medications on the market, I was still denied for that treatment. And I was told that I needed to try, I believe it was 3 or 4 of the medications I had used previously in order to get on biologic medication. And there was a lot of frustration with that. I felt that my best interest was not being kept in mind with that decision. And I pray and hope that it wasn't AI that made that call. Once again, I'm unsure, but regardless, I think that a lot of work needs to be done on that department to make sure that everyone's getting the treatment that they need.
Right, right. I mean, it's so important these days with the rise of many new treatments for example, in a disease area like atopic dermatitis. There are a lot of new therapies on the market, and a lot of money spent on innovating and creating those therapies. But then ultimately, who decides who receives the therapies? And
Right.
in particular, you mentioned your friend having to make sort of life-changing decisions. I think a lot of people are confronted with that.
Right.
Um,
Right. I
in
think
in your work with the co-design that we've done, obviously we can't speak to the exact projects there, but do you see that sort of in patients inputting into the design of solutions as part of that solution to sort of bring the human side into business?
No, I believe that as patients, as advocates, we should very much be involved in the process. At the end of the day, we're the ones that will be impacted by this technology, and we need to make sure that we're using our voice to make sure that our needs, wants, when it comes to our healthcare, are being understood and represented and implemented with this technology.
Yeah, it's sort of bringing the human side back into healthcare. Um,
Right.
let's see. I think increasingly important based on the topics we've been discussing here. Um, on that note, a lot of the listeners for the podcast are coming from uh, within industry. They're working on the solutions of tomorrow.
Hmm.
And I think one thing which everybody is looking at is how do I bring AI into my job? So maybe we can switch tracks here for a moment.
Sure.
Both of us are using AI, and you in particular, I think, have started to adopt AI into business, and not just the healthcare aspects, but in all aspects of running a business, doing the job.
Hmm.
How walk us through like sort of how you are using it today.
Yeah, of course. So I regularly use several different tools. I know I've already mentioned ChatGPT and Gemini. I think those are great AI tools to get started with. Another is Claude. It's in the same vein, but probably a little less known at this point in time. I primarily use AI technology for uh, research uh, and content creation, right? So one of my favorite applications of that is has allowed me to use AI to create scripts for Instagram Reels or TikToks, right? So through my job, I'm constantly having conversations about social media or digital marketing best practices, right? So I found that if I'm able to record those conversations, I can then create a transcript, uh, uh, use that input in ChatGPT or Google Gemini to analyze that content, come up with a few different content or topic ideas. Um, I found that uh, I found that I can upload that uh, information into ChatGPT, and it can provide me with the output of multiple different topic or conversation ideas that I can then use to create scripts. So it's a multi-tier prompt. Then have it use the transcript to come up with multiple ideas that I can pick from. Once I've selected the one that I think is the best, I provide AI with a few specific requirements for that. So I make sure that it has a solid hook at the beginning to really capture the viewer's attention. I also make sure that it's engaging and educational, and I also require the script to be 1 minute or less to help keep it within the parameters for the video content on social media.
So you're using it primarily for content creation. Is that correct?
That's a big piece of it, yes. You know, the amount of time it takes to, or I found that before AI, I was spending a lot of time coming up with content ideas or even just generating a copy. You know, in the social media world, especially if you're working with a number of clients, you might have to write copy for 10, 15, 20 different posts in a day, and that can take up quite a bit of time. You have to switch lanes with where your mind's at and really reflect on that particular client, their target audience, etc. And I found that AI has really allowed me to streamline that process and be much more efficient with that task on a daily basis.
And previously, would that have been just yourself with a lot more time and effort, or would it have been outsourced or other people?
A little bit of both. A little bit of both. Um, quite honestly feel bad. I had a partner I was working with that would write social media copy for me. She did a great job, but as a business owner, we're always looking for ways to be more efficient with our spending, and fortunately, that's one of the areas that got cut. Now, with that being said, if I do require social media copy that has a bit more of a personal human touch, you know, I'll still tap into her, or I will, you know, write it myself. You know, but AI definitely gives me at least a starting point. You know, I wouldn't advise anyone to just take whatever AI pumps out at face value and use it for their social media efforts, their digital marketing efforts. But it is a great starting point. I'll say that.
Yeah, it's a good point. I think if you know the area and know the topic, you can be the expert and judge of what AI has produced. If you
Right.
don't, you have the risk of that it's produced something that's really not relevant.
Right.
And your story about working with somebody perhaps in a different way here is also instructive because it is impacting people's previous jobs.
Yeah.
And
I mean,
I'm sure we go ahead. Go
just to
ahead.
speak to that on further, you know, when I mentioned earlier, I was using AI about 5 years ago with when I worked for one of my previous employers, and part of that process on a daily basis was teaching AI to come up with the most appropriate response based off the inquiries we were receiving, right? Well, they essentially were having us train AI to eliminate our jobs.
Yeah.
And that is definitely a concern of mine moving forward. I think, once again, AI has a lot of wonderful applications, but we need to put people first. And I've already seen it in my industry. It's replaced a lot of jobs, copywriting. There's also AI tools to help folks run paid advertising campaigns that kind of eliminate the need for someone such as myself. And I can only see this going, you know, further and further, or becoming worse and worse as we proceed down the road. Just there's always something new being developed that is eliminating a need for an actual human in that role. We've seen it in manufacturing here in Detroit with robots and the auto industry, right? I don't really see it stopping. I think it's a matter of learning on an individual basis how we can implement it and make it work for us, and not being necessarily scared of it, right? But adding it into our lives and using it in a way that's going to improve it.
Yeah, on that note, let's look at sort of the future a little bit. We can project where this may be going. Perhaps it's difficult in 5 or 10 years, but looking just down the road, like this year or next year, where do you see this heading?
I think sky's the limit. Technology is growing at an exponential rate, right? It's getting more and more complex, um, better outputs. I can see in 5, 10 years, I feel like the landscape as we know it will be completely different in that amount of time. I don't really know what exactly that world will look like. I just know that AI will have a much more uh, prevalent role in our daily lives. So once again, we need to make sure that we're embracing it, not pushing it away. Otherwise, we'll find ourselves in a much tougher position. It's not going away. It's definitely not
Yeah.
going away.
In the healthcare side, I mean, it's definitely also having dramatic impacts on the way that healthcare is delivered and the way that innovation is conducted, sort of in pharma pipelines as well.
Hmm.
Mm. Coming back to that theme on sort of the ethics of AI, what do you think, that we need to do as maybe society or patients in dealing with applying AI in the right way in the next few years? Do you have any thoughts on that?
Yeah, I don't know how this would be done, but we need to make sure that AI is championing, human values, right? An emphasis on empathy, compassion, uh, create creative solutions, even with healthcare, right? Thinking outside the box. Once again, I don't know how that'll be done or what that looks like, but I think that's really important as we proceed with AI being implemented in healthcare. We have to find a way to really maintain that human element. I think
Yeah,
that's crucial.
it may even go into the training of the models itself. So those are sort of the basic building blocks of all AI.
Hmm.
Uh, and as we were discussing there, if the models are trained a certain way, you get certain types of outputs. So I'm wondering if the input of patients, patient journeys, and patient information could potentially improve the AI itself. Um, it's
Yeah.
probably it's a big challenge to do that, but certainly more interesting than just the looking at medical records or looking at what social media has said.
I'll agree with you there. And a big part of that could be creating focus groups where, once again, we can use our voice to make sure that we're being represented uh, when it comes to developing this technology. Um, taking, on another note, just making sure that policies are in place on a federal level to make sure that, you know, uh, data privacy protections are in place, that uh, patients using this AI aren't being exploited in any sort of way. I think that's also really important with the development of the tech. Otherwise, we're just opening up doors for all sorts of issues to arise.
How can we ensure that AI has this human component when it comes to patient experiences?
Yeah, that's a great question, Kevin, and I think that's a little bit easier said than done. At the end of the day, it is technology, so trying to incorporate that human element will certainly be a challenge, but I think it's imperative to the success of AI when it comes to patients and healthcare. I think a big part of it is making sure that we're not succumbing to data bias, right? AI algorithms are trained on data, so if that data that is being trained on is not accurate or reflects a certain bias that could, provide potential issues, right? If there's like racial or socioeconomic bias in that training. So it's really important to make sure that we're staying away from that in the whole process, um, and that we're not limiting the scope on that training as well. We want to make sure that everything is encompassing of all the various uh, healthcare issues that folks are experiencing, so we can ensure that they're getting the best possible information at the end of the day.
Yeah. Well, this has been a really thoughtful and interesting discussion. I have a few rapid fire questions for you,
Sure.
and just off the cuff. I'll ask you these and see what comes to your mind.
Okay.
Chat GPT, is it a friend or enemy?
I think I think at this point it's a friend. I think that as I mentioned, it's provided us all with an unprecedented tool in our lives, right? Not once in human existence have we had access to something like this. So I think it's at least personally uh, really enriched and brought up the quality of my life through being able to access those tools. But once again, I think there's a lot of room for negative actions to take place with AI technology. So it's all about. I think it all goes back to the user and what their
Mhm.
intentions are with it.
Yeah. And you mentioned your work in, I believe, social media and marketing communications. What's your favorite meme?
I might be dating myself a little bit because this is a little, I would say, more on the in the early internet days, or early 2000s, but maybe even a little later. But the Velociraptor memes, I don't know if you're familiar with them, but I always
Yes.
got a kick out of those.
Yes. I think some of our audience will remember that. A lot of
Okay.
our audience. Um, and the big one, how long do we have until AGI, the general intelligence of AI?
Oh man. I'll say 10 years. I'll say 10 years. I think that's a
Yes,
good number. I mean,
that's a good number.
yeah,
Yeah.
come a long way since 2018. I just see it improving much faster in the next 10.
It's been really good discussing with you, and thank you for your time. We
Yeah.
will hopefully see you again in less than 10 years.
Yeah, well, thank you again, Kevin. This has been a blast, and I'm very excited that we got to have this conversation today. Thank you again.